Good afternoon and welcome. Thank you for joining us today for our training, Tools for Creating Calm in Times of Distress, Part 2, hosted by the Center of Excellence for Behavioral Health in Nursing Facilities. I am Nikki Harris, Training and Education Lead for the Center of Excellence, and we truly appreciate each of you for joining us today. And now, I am happy to introduce our presenter for today, Mr. Matthew Rosa. Matthew is a licensed clinical social worker, consultant, and founding member of NIATech. Matthew provides training, coaching, technical assistance, and planning support to universities, research studies, governments, and health and human services provider organizations. Matthew's current area of focus include evidence-based practice, implementation, process, quality improvement, staff and team development, and a wide array of training topics. I'll now turn it over to Matt to begin the presentation.
Thank you very much, Nikki. I appreciate that. Thank you, Derek, and thank you all for being with us today. It's great to have you. And hopefully you were able to join us last time, and we'll be meeting with you again today. And we're going to cover a good bit of content today during this half hour. And what we have planned is a series. The next of the sessions of these sessions will be coming up in November, on November 2nd. And then we will have subsequent additional sessions, which will allow us to do a deeper dive into some of the content that we explore today. So if you have some questions and some personal experiences related to some of these topics, we will have a chance to talk about those. Those will be 1-hour sessions. So that's going to create some more opportunity for dialogue with you. So look forward to those. You'll get some information regarding registering for those, and we hope to see you at the future sessions in November and then in December. So let's go ahead and get started with today's content. We have these 4 learning objectives that we want to focus on, talking about developing greater empathy and understanding. These are the objectives that we had last time, and we want to reiterate them and refocus on them. Gaining insight into your personal reactions to distress. We spent a good bit of time last time in our previous session talking about those 2 elements. Now we're going to pivot a little bit toward these second 2 objectives, reviewing some tools that are going to help you to respond to distress, help you to engage individuals, and then thinking about some risk and safety factors as well. So that's our agenda for today's session. We're going to start with a few tools that we think are going to be very practical and useful for you, things that you can just start doing. One of the things that we often like to think about as it relates to distress is the issue of trying to fix stuff. There is this fixing reflex or writing reflex, if you're familiar with motivational interviewing, that's what it gets called in motivational interviewing, this desire to fix things. And many of us who work in helping professions, social work, human services, nursing, healthcare, have a tendency toward a strong reaction to distress in terms of a desire to fix it. So one of the things that we need to think about as it relates to these tools we'll be exploring today is whether or not that reaction and desire to fix is the best path to managing and supporting and helping to diminish the distress that the individual is experiencing. One phrase I like to use is this one: don't just do something, sit there. So obviously it's a little playful flip on what the typical language is. Don't just sit there, do something. In this case, we're saying, sit back for a minute, sit with the situation, try to avoid the reactive fix-it orientation. Take a moment to consider, take a moment to sit with the person, to sit with what you know and what you can learn about the situation. So that's kind of a guiding orientation to our content today, that compassionate presence, mindful of the person's experience, trying to understand where they are, and slowing down for just a moment in order to have that perspective and awareness as you try to consider the next step. So I'd like to talk with you about three particular tools that I think are very useful when you're trying to respond to high levels of distress. And we're going to start with motivational interviewing from a very kind of core sense of motivational interviewing. Obviously, that's a evidence-based practice which takes quite a long time to master. It's rather complex approach to providing supports. In this case, we're going to use some core concepts from motivational interviewing to help us to think about responses to distress. These are some key strategies that are critical to motivational interviewing. Trying to focus on the person, not the behavior. Trying to avoid any forms of judgment. Trying to think about who people are instead of what they're doing. And helping them to identify their strengths, hopes, and dreams. So it does have that very strong strength-based orientation. These things can be challenging when someone is engaging in behaviors that's particularly worrisome or concerning or risky. These are hard things to do in those moments. And so we're kind of calling ourselves to, while monitoring and managing safety and risk, and we'll talk more about that in a minute, trying to see that person as an individual. One of the key elements of motivational interviewing is this idea that we're all ambivalent, that we're all kind of uncertain about the decisions that we are making. And so using reflective listening, trying to understand a person's ambivalence, maybe you've heard about that idea of sort of the tug of war. And if you drop the rope, people won't keep pulling back. If you try to pull someone toward a behavior or push someone toward a behavior, it's likely that they will be resistant to that. Most of us are. If someone tells us, well, the thing you need to do is, most of us sort of step back a little bit and say, well, I'm not so sure I'm comfortable with you telling me what it is that I should do. On the other hand, if you ask me, what do I think? What is my experience? Then I might lean forward and be more considerate of your perspective as we move forward. So how do we try to avoid that argumentative orientation and try to be mindful of that potential push-pull that we might have with people? And empathy at that moment is trying to look at the experience through their eyes, trying to be collaborative with the person, and trying to avoid that resistant experience by aligning with the individual and understanding their perspective. Helping them to think about pros and cons of the behavior, of the decision that's being made. How might they do something different? What are going to be the likely outcomes if they continue on one path versus another path? Granted, this conversation is not particularly useful if someone's highly agitated, where they're not in a position to kind of weigh something. But you can do this in simple ways by reminding people of the potential challenges that they might experience if they continue to engage in a certain behavior, and reminding them of sort of some of the benefits of other behaviors. Again, doing this from a thoughtful, person-centered perspective and making sure that we're recognizing the individual and not patronizing or infantilizing someone by reminding them of consequences. That's not the intention here. It's to allow the person to consider their own decision and to be thoughtful about what they might want to do and what the results of their choices and behaviors will be for them. These are the four core ideas related to motivational interviewing. As I said, motivational interviewing is a complex and broad evidence-based practice. But at its core, it is these four things: working to engage someone and using the ORs under that engage box of open-ended questions, affirmations, reflections, summarizing. I'll say a bit about those in a moment. Focusing them on whatever it is that is the issue of concern, trying to evoke some thoughts within them related to change that is positive and helpful to them, and then helping them to plan to move forward. So that's kind of the core of what motivational interviewing is all about. I'd like to now switch to talking a little bit about grounding activities. Some of you may have familiarity with grounding exercises. You've probably done some. If you've done any kind of meditation or relaxation exercises or group activities. If someone asks you to sit with your feet firmly planted on the floor and feel your toes in the bottoms of your shoes, and squeeze your hand muscles and then let them relax, or pick up a pen or a pencil and feel the weight of it, the temperature of it, etc. These are all efforts to ground a person in the present moment, in the current situation. When people get highly dysregulated and distressed, they are vulnerable to losing track of their environment, losing track of awareness of themselves within their environment, losing track of the fact that they're safe, that there are no significant risks to their health or wellness, particularly if they're very anxious or worried or angry. They might not be able to see those things, and grounding activities reground them in their current environment and help them to feel safer and more comfortable, and then hopefully reduce that level of distress that they're experiencing. There are plenty of grounding activities and exercises. I encourage you to look at some. You can go online to a lot of different resources. Consider experiences that you may have had related to those kind of mindfulness practices to help you to be more aware of your present and current environment as a way of de-escalating any distress that you're experiencing. One of the things that sometimes people say in response to that idea is, I'm working with people who aren't going to do one of those formal grounding exercises, or they're not in a space where that will be a logical or sensible activity for them. There are plenty of ways to do grounding that are less formal. My simple example, I like your hat. What do I mean by that? If I ask someone or make a comment and say, I like your hat, if someone is distressed, or if I talk about the weather, or if I talk about whether or not their chair is comfortable, what I'm doing is I'm taking them out of whatever the distressing circumstance may be and placing them in the current environment and reminding them of their current environment. It is an informal grounding activity. Now, I will offer a caution related to this, which is if you ask someone if their chair is comfortable and they've just told you that they're furious or very scared or very upset about something, there's the risk that that will seem dismissive of their concern. So you do have to be mindful of the context of the conversation. Given that caveat, given that concern, there are plenty of ways of engaging with someone related to their concern and then injecting something related to the physical environment. Are you comfortable? Is if you say to someone, for example, oh, I understand that you're really upset about this. Let's talk about this. Oh, by the way, are you comfortable? Is this room too warm, too cold? Do you need a blanket? Are you okay? Are you good to go as we start to have this conversation? All of that is some initial grounding of getting that person to feel comfortable in their environment, to be aware of their environment. And it's serving a double duty. It's also hopefully engaging and showing that you have empathy for their position, for their experience, for their comfort, which is a strongly compassionate, empathic place to start, which will probably de-escalate even before you start having a conversation about whatever it is that is creating the issue of concern for them. A lot of what we're talking about related to motivational interviewing and grounding is related to questions. If you've ever seen the show Hamilton, you'll know that Hamilton is encouraged at one point in the show to, quote, talk less, listen more. And that is, I think, core to managing distress. How do we find ways to listen, to ask more questions, and particularly to ask those open-ended questions, some version of why, how? Tell me more is not a question, it's an assertion, but it's a version of eliciting more experience from the individual. It sometimes is fun in a meeting, if you might be working with your team, to have everybody do a simple exercise where you have people break up into dyads. And the first part of it is to have one person try to convince the other person to do something, and then flip whatever the person's thinking about doing. Maybe they're thinking about buying a new car. Your job is to convince them to buy a new car, and then redo the exercise. And now your effort is to ask them questions. Why do you want to buy a new car? How do you think it would impact? How is it going to impact your finances? Do you have any concerns about it? Tell me more about your thoughts related to buying a new car, and see how the person responds to those two experiences. It's most likely that they will be much more likely to engage with you with those questions. And if you start trying to convince them to do the behavior, they're likely to pull back from that particular option. So a fun exercise to think about doing with your teams. One of the ways to dig in on asking these questions is to use a cause and effect diagram. This is the kind of typical fishbone diagram. I prefer to do it as a circle where we just put a problem in the center. And this is something you can do with your team in relation to a particular resident's challenges or issues. What's the problem? And then what do we know that's causing that problem? Why is it happening? And then we ask, and they see those C's around the problem. Those, we've came up with 4 primary causes, but then we ask a question about those causes. What's causing that cause? Well, what's causing that? And what's causing that? And that's how we get to the root cause, by continuing to ask those why questions. Why is that happening? Why is that happening? And that's a really nice strategy as a team, to ask questions, to better understand, and again, to cultivate that empathy for the person's experience. So let's pivot and take a few minutes to talk about risk and safety concerns, remembering that we're going to dig in deeper on these when we get back together in our subsequent sessions. Where do you see risk in your encounters with folks? These are some of the typical areas where we tend to see a higher level of risk as it relates to the experiences you may be having with residents. Number one rule from my perspective as it relates to risk and safety concerns: regardless of your experience level, even if you've been doing what you're doing for 25 years and consider yourself, and everyone else considers you to be highly expert, always do this work as a team. There's no point in trying to address risk and safety concerns in isolation. It's always best practice to do this with others. Much less stressful. And of course, it's always great to get the feedback and input from the rest of your team. When we think about strong emotions, there's a list of strong emotions. Which one of them are likely to create risk or crisis? Take a look at those. Those are the 3 that are more likely to create crisis for folks. Sadness might and or depression might result in self-harm or suicidality. Fear might create panic, and anger might result in rage. Remembering that anger and rage are not the same thing. Anger is an emotion, and rage is a behavior in response to that emotion. Right? So those behaviors of rage might result from anger. We also have to remember that empathy is not risk tolerance. Some of us might feel like we need to tolerate risk because that's the empathic thing to do. It's not empathic to tolerate high levels of risk for the other party or for you. If anyone is at risk in the environment, then everybody is at risk. You, the other person, other residents, other staff. So we want to make sure that we're always focused on safety, and we might need to take actions to make sure that everyone is safe, remembering that all of those parties, the safety of everyone is critical. Thinking about the space that you're in, how do you maintain safety in regards to the physical plant of your environment, and thinking about the longer term risks of unsafe environments, empathy fatigue and burnout that can occur as a result of being in environments where you're feeling unsafe. Those are critical issues of concern that we need to be always attending to. When we look at crisis circumstances, we have to pay attention to the client's affect and not their content. One of my silly examples for thinking about that is to think about the Charlie Brown cartoons, and whenever Charlie Brown's teacher talks, we hear wah, 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 wah. We never hear the words, but we know exactly what's going on because we're paying attention to the affect and the context. And that's what's critical when someone's in crisis, not the words, the emotions, the affect, the experience that they're having. Think about the current issue, try to stay focused on the current issue, focus on problem solving in the manner that we described, not quick fixing, but thoughtfully engaging, and some commitment to action to try to resolve the situation as it's being described. Thinking about ways to reduce the distress and to keep things in that safety zone related to that level of distress. It's creating a timeout, creating some soothing activities. One of the things that you'll notice is if you quiet your voice and slow it down, everything gets a little slower and everything calms down a little bit. That probably just happened for you because I'm doing that. That's not always the case if someone's highly agitated, but it can, and you also have to pace them. You have to stay close to them. You can't go to a state of extreme relaxation when they're way up here at an 8. You probably have to get to a 6 and then try to get to a 5 and a 4, and hopefully they'll follow you down as you go. If they're at an 8, you come in at a 2, they're going to say, that's not empathic. You're not connecting to where I'm at. You're not close enough to where I'm at to be of any use to me. So mindful of being relevant to the person's experience. Thinking of these different ways to create that process for moving more slowly, being mindful of how stimulating you are, being mindful of excessive eye contact, which can be agitating for some folks. One kind of focused way to think about suicidality and self-harm, I'll leave as our last tool for today. And we'll dig in deeper on this issue as needed when we come back together. SLAP, severity of the ideation. What's the severity of the person's stated self-harm intent? What's the lethality? How lethal is the particular means? Do they have access to those means? And the proximity to support, what kinds of support do they have in their life? These 4 questions are particularly important and helpful when you're trying to assess related to self-harm or suicidality. Always related to suicidality, make sure that you're always as genuine as you can be, showing people that you care and asking about it. Some people have this concern that if they ask about suicide, they might place people at a higher risk. That's absolutely not the case. The best thing you can do is to ask, and ask in clear, empathic language. Don't use euphemisms, use clear language so that the person can communicate and know that you're able to understand and appreciate those issues and that you're there for them. So if we do these things, we're going to provide you with these tools. You will have the tools that you need. We're going to save some time, and then you're going to be able to get back to the tasks at hand that are the critical things for you to do. So as I said, we're going to talk about questions and issues in our subsequent sessions starting on November the 2nd. So I look forward to that dialogue with all of you. So please join us for that.